Thank you all for joining us today. I'm Renee Boynton-Jarrett, Associate Professor of Pediatrics at Boston University School of Medicine. I'm also a primary care pediatrician at Boston Medical Center and a member of the Child Care Aware of America Board of Directors. I'm so excited to join you here today to share the results of this important study. I also want to thank you all for completing the study and providing your information to the Yale University team to make this study possible. A few notes. First, we'll hear a presentation on the findings and their implications for the childcare industry. Then we'll hear from some of our valued partners in this project. And finally, we'll turn to questions and answers. Please keep yourselves on mute, even during the question and answer section. With this large of a group, we will manage Q&A by using the chat function, and I'll be sure to share those questions with the presenters. Now, let's get to the reason why we're all here. On Wednesday of this week, researchers at Yale University released the results of the first ever large-scale assessment of the risk of working in childcare during the COVID-19 pandemic. Their findings show that childcare programs that remained open throughout the pandemic did not contribute to the spread of the virus to providers, lending valuable insight to parents, policymakers, and providers, which we're going to talk about today. A paper on the results of the survey will appear in the January 2021 issue of Pediatrics, the peer-reviewed journal of the American Academy of Pediatrics. You will find a link to this paper as well as policy recommendations and a social media toolkit for CCR&Rs and much, much more on the Child Care Aware of America website. I am pleased to introduce our presenters tonight. Dr. Walter Gilliam, lead author of the study. Walter is the Elizabeth Mears and House Jameson Professor of the Child Study Center at the Yale School of Medicine and the Edward Ziegler Center in Child Development and Social Policy at Yale. Dr. Lynette Fraga, CEO of Child Care Aware of America, is also here with us this evening. We are honored to have with us two additional members of the Yale University research team. Dr. Thomas Murray, Associate Professor of Pediatrics, Infectious Disease at the Yale School of Medicine. Dr. Saad Omer, Director of the Yale Institute of Global Health. And we're grateful to have two leaders with us tonight who played a critical role in the survey process. Rian Evans-Alvin, CEO of the National Association of the Education of Young Children, and Dr. Kimberly Belcher-Battle, Executive Director of the National Workforce Registry Alliance. Now, let's get started with Dr. Gilliam.
Such a pleasure to be here with you today. Thank you all for being here and being a part of this webinar. Thank you for those of you who did participate in this survey. There was 57,335 of you. Thank you for giving your time to this. That survey took at least 20 minutes of your time if you participated in it. And when you add that up, that's over 19,000 hours of your time in order to make these results possible. We could not have possibly been able to answer the questions that we wanted to answer for you without your help. So thank you very much for your participation in this. But most importantly, thank you for what you do for children and families and for those amazing people who care for them every single day. So let me jump into, first, before I say anything else, let me also repeat what Dr. Boynton-Jarrett said. We could not have also done this without the help of a lot of people within the child care field. And that means Child Care Aware of America and also the National Association for the Education of Young Children and the National Workforce Registry Alliance and its state registries in each one of the states. It was mostly through these state registries that we were able to find as many childcare providers as we needed in order to be able to participate in a survey like this. In many ways, these state registries are the emergency broadcast service of the childcare workforce. And without them, there would simply be no way to be able to find you. So what we did was we conducted a survey between May 22nd and June 8th, and it was a survey that was epidemiological in its nature. Most of the questions were about health concerns, about pre-existing conditions that you might have, whether or not you'd ever tested positive for COVID-19, or whether or not you had been hospitalized with a diagnosis of COVID-19. But we also collected information regarding your amount of contact with childcare, whether your childcare program was open or closed, amount of different types of activities that you might have done in order to try to ensure your own safety in your own time at home, such as wearing a mask when you go out in public, or keeping social distance, or maybe even canceling different types of social events that you might normally attend. And then we also collected information about the different types of practices that you might have employed in your program in order to keep children safe. Things like hand washing, things like temperature checks and symptom screenings at the door, cohorting, keeping children together and not mixing between groups, small group sizes. And then when we collected all this information, again, on 57,335 of you across all 50 states and Puerto Rico and DC, accounting for over 71% of the nation's 3,100 counties, we then took that data and we combined it with another data set, the data that are being collected by Johns Hopkins University on COVID-19 background transmission. And after we merged those data sets together, we were then able to answer questions having to do with the role that childcare may play in the spread of COVID-19. And ultimately what we found was this. We found good news. We found that childcare providers were engaging in a whole host of things necessary to keep their children safe. They were doing 3/4 of them were doing temperature checks and screenings at the door. About 1/3 of them reporting that they were doing that twice a day, temperature checks and symptom screenings. About 90-some% of them disinfecting every surface and fixture at least once a day, and over half of them as many as 3 times a day. 90-some% of them frequent hand washing of adults and the staff, and on and on. And the good news is it seems to have worked. When we analyzed the data, controlling for background transmission rate that happened in the community and a whole host of other types of factors having to do with the demographics of the childcare provider and what they were doing in their own home, we found absolutely no relationship between childcare providers who went to work on a regular basis and saw children in childcare versus those who didn't. In other words, there was zero evidence that childcare had any relationship whatsoever to whether a childcare provider became sick of COVID-19 or was hospitalized with COVID-19. Now, it was fortuitous at this time that when we did the analyses and we were looking at these childcare providers and programs, that about 50% of the programs that responded to the survey, those childcare providers were working at the time and had been working throughout the beginning of the pandemic up until the time that we collected the data. And the other 50% were not working, either because their childcare program had closed or because they were staying at home and not working. Maybe because they were laid off, or maybe because they just decided that it was safer for them to not come in. Either way, about half of the childcare providers were exposed to childcare and about half of the childcare providers were not. And when we analyzed the data, again, no relationship whatsoever between exposure to childcare and the added risk of whether or not that childcare provider would ever have COVID-19 during the time that we were analyzing the data. Now, it is true, though, however, that childcare providers, unfortunately, did get sick. Out of the 57,000 that we surveyed, 427 of them did report getting COVID-19 or being hospitalized for COVID-19 with a COVID-19 diagnosis. But again, the reasons that they got hospitalized seem to, in the analyses, have zero relationship to whether or not they were working in childcare or not. So in other words, the reasons that they caught it seem to be unrelated to actually being in a childcare program. It's also true that unfortunately our Black, Brown, and Native American childcare providers carry the heavier burden of COVID-19. which is similar to what other people have found in other studies of COVID-19, that it's our communities of color that are more likely to be affected. And we found that too with childcare providers. However, even with our Black and Brown and Native American childcare providers, their rate of COVID-19 was unrelated to whether they were working at the time in a childcare program or whether their childcare program had been closed or they weren't working. So in other words, zero relationship between working in childcare and testing positive or being hospitalized for COVID-19. Now, it's also important to realize, though, and to keep the data in context of the fact that these childcare providers were doing incredible, near Herculean things when it came to trying to keep their children safe. We're talking about small group sizes, about 6 to 8, about on an average about 6 children per group in home-based childcare programs, about 8 in center-based programs. 3/4 of them, like I said before, symptom screening at the front door, every adult and every child who came in, and about 1/3 of them more than once a day, cohorting, keeping children in the same group and not mixing those groups, keeping cots and seats apart at least 6 feet, frequent hand washing and disinfecting, and on and on. And we're not actually supporting our childcare programs in the way necessary for them to be able to do that, but they did it anyway. And what's amazing about this is that it's a bit of a victory story that these childcare programs were able to do all of this and at the same time be able to do this in a way that was going to keep children and themselves safe. So another thing that would be important to bear in mind here too is that, as I said before, childcare providers did unfortunately become sick. And one of the driving factors of that was, of course, not what was happening in the childcare program. It was community transmission rates. One of the bigger variables that was associated with the likelihood of a childcare provider becoming sick was transmission rates in their own county. And the more COVID that was happening in their county, the more likely they were to become sick. So when you put all of these results together, the basic finding is that childcare does not seem to pose a threat to communities in terms of COVID spread. However, that does not mean that communities can't pose a threat to childcare. And so in order to be able to keep our childcare programs open, we need to keep down COVID within the community in which these childcare programs are operating so that these childcare programs can have a chance to be able to succeed. And we need to make sure that our childcare providers have access to the supports they need and the supplies they need and the staffing they need in order to be able to continue to do the amazing things that they're doing in order to keep our children and families safe. In a lot of ways, when you think about it, the measure of a society in terms of how much it loves its babies is how well it cares for those who care for those babies. And if childcare providers become sick in their community, but they have to go to work in order to be able to make ends meet, because we know that childcare providers are drastically underpaid. And we also know that childcare providers don't have salaries in most cases. They're hourly workers. And so when they can't come into work, in many cases what that means is they go without pay. And so we need to have ways to be able to make sure that childcare providers do not have to make this Sophie's choice between whether I come in sick or do I stay at home and perhaps not have the resources that I need in order to be able to take care of my own family. You know, that's a terrible place for us to put childcare providers. And it goes back to this big overarching point that I'd love to make, which is that if we want to keep childcare programs safe, it's about making sure that we cut down on transmission within the community so that we don't make it too hard on these childcare programs, and that we also take care of these childcare providers. And going back to the issue of equity and race and the fact that our Black, Brown, and Native American childcare providers were more likely to get sick, even though that sickness may not be the cause of childcare, it's still going to pose a threat to childcare. And so if we want to make sure that we take care of our babies, it means finding ways to take care of our Black, Brown, and Native American women who overwhelmingly are the ones in the workforce taking care of children in childcare. And so with all that having been said, I thank you very much for being here, and I pass it back over to my friend, Dr. Boynton-Jarrett.
Thank you, Walter. Now we're going to turn to Child Care Aware of America CEO Lynette Fraga to share recommendations in response to the report's findings.
Thank you so much, Dr. Boynton-Jarrett, and for all of those participating, thank you for joining us. And to Dr. Gilliam, thank you. This study is so important to our collective work. So Child Care Aware of America dug into the study findings, and we know that there are implications for our nation's economic recovery and for parents and providers and for policymakers. Simply put, without childcare, there can be no economic recovery as parents, employers, and communities rely on this critical infrastructure. So the study is critical as we seek to support parents. It's critical because of what we're hearing from parents like Kate in Oregon. When her childcare center closed due to the pandemic, she enrolled her two young children in another program in the area. This may sound familiar to some. Unfortunately, only a couple weeks later, that program closed permanently as well. And Kate was left scrambling to arrange care for her children so she could continue to work. And Kate's story is so far from unique. Across the nation, families are under increased pressure due to disruptions in childcare. And we know that when children are exposed to high levels of stress over time, it can undermine their ability to learn and thrive for the long term. And we need to have a greater sense of urgency around solving the problems that are adding stress for our families. We also know that young children need social interaction and a stimulating environment to keep learning and growing and thriving. Early childhood providers play an important role in establishing the foundation that will last a lifetime. All of you know this. We need to make sure this essential sector remains viable. And indeed, parents across the country are asking the question, is it safe to send my child to childcare? To do right by children and families now and through the recovery, we can't ignore the essential role of the childcare sector. And this study is also critical because of many of you, the providers. The study found safety measures as effective, but providers need help paying for them. To be clear, childcare providers were among the first to respond with a plan that kept infection rates down, playing a central role in communities across the country. As Dr. Gilliam said, purely heroic and amazing Herculean efforts. It's a clear illustration of how effective providers have been throughout the pandemic in preventing mass spreading and outbreaks and providing healthy spaces for children. Providers have taken tangible, proven steps like disinfecting and cleaning multiple times a day and hand washing and symptom screening and small isolated groups of children, cohorts wearing personal protective equipment. Enhancing and strengthening health and safety measures has increased costs for providers. Equipment costs money, sanitizing costs money, smaller group sizes require more staff who need to be paid. All of these things mean resources and mean expense. Early child care providers were already operating on very slim margins before the pandemic. The viability of this essential sector is now at risk because we can't make ends meet. They now face substantial reductions due to COVID-19 group limits because most of their income comes from tuition payments. Every day we're hearing from child care providers like all of you, with enrollment down and increasing again. However, with expenses too high, from cleaning supplies to additional staff to handle smaller group sizes for children, early childhood educators and providers are very worried that their programs may not be able to make it. And we should be worried about this too. And it's critical for policy change. Robust relief is needed. There are real steps policymakers can take to be responsive to this study and the experiences of parents and providers that I've shared. Congress has to approve stabilization funding for childcare, no doubt. We need state and local officials to make evidence-based decisions about whether or not childcare is open, and we need all policymakers to support the policies that care for childcare providers so they can safely care for children. First, everything we've learned through this study points to the need for additional investment in childcare. As this study shows, in some communities, it may be safe to open childcare with significant investment in considerable mitigation efforts. In other communities, while childcare may not be responsible for the spread of COVID-19, background transmission rates may require ongoing or variable closures. Both scenarios demand investment to stabilize the childcare sector. So Congress has to provide at least $50 billion in childcare stabilization funding. Without this robust relief, childcare providers may permanently close. And I'll repeat what I said earlier. Without childcare, there's no economic recovery because parents and employers and communities rely on childcare in this critical infrastructure. In addition, even with additional investment in childcare, local and state policymakers will have to make tough and ongoing decisions to open or close childcare. This study shows background transmission rates matter. So these local decisions must consider the best public health guidance and be developed with deliberate, resourced input from all stakeholders, including you and many others in the child care system. Finally, I say to all policymakers, our obligation to children involves a responsibility to keep the adults who care for them safe. This means providing healthcare coverage, unemployment insurance, and paid sick leave for childcare workers. And we must prioritize healthcare access, regular free COVID-19 testing, and future vaccine access for childcare providers. So in summary, no childcare, no recovery. This is what we know is clear. To keep the vital childcare sector open and viable, providers need help so they can continue to implement the enhanced health and safety measures. Communities must consider background transmission rates when making decisions about opening childcare. There just is no doubt. Congress must provide $50 billion in childcare stabilization funding, and soon. And if childcare centers close their doors, we lose a critical piece of our economy's infrastructure, not to mention putting providers out of work, and of course, all that children and families need in quality childcare programs. Delaying stabilization funding doesn't just postpone our economic recovery, it makes it harder, and we need swift action. So with that, I will turn it back over to Dr. Renee Boynton-Jarrett.
Thank you, Lynette. Now I'd like to ask Rian Evans-Alvin of NIAC to speak of NAEYC to speak about her organization and its role in the process. Thank you.
Good evening. Thank you so much. It's great to be here with all of you and to be part of this and to have been able to help distribute the link to our members to be able to participate in this survey. And I am so grateful for the opportunity for providers, for early childhood educators, to be able to raise their voices in this COVID crisis and to tell their stories. And so important that as advocacy organizations, we hear directly from providers. And this really important study from Yale University helps us to do that. So thank you to Walter and your team for giving us this opportunity. I know many of you who are on with us tonight are early childhood educators working every day with young children, your providers, your operators and owners. And I just want to say thank you for the bravery you have shown, for the courage you have shown, for your tenacity. In many instances, you're swimming upstream and serving children across the country in really precarious conditions right now. And so for your willingness to do that, we are incredibly grateful. I just want to reiterate a couple of points from a policy perspective. First off, that this study was conducted in the summer when there were significant social distancing policies in place and enrollment limits in settings. And so as states look to reopen care and education, as states look to reopen their systems, that we keep in mind that enrollment matters, that we keep in mind that all of the policies that have been in place to allow these conditions to happen are still in place. That is incredibly important. The second piece is that as states are considering opening and considering going back to full enrollment, that we really continue to look at licensed and regulated care. That part of, I believe that part of the reason that the findings have shown what they have is because we have a multi-decade long track record of being able to serve children in licensed and regulated care, where providers have been able to realize the inextricable link between education and care. And in that regard, they are very well adept at all of the health policy that needs to happen to make these settings safe. And so we've got to continue to look to the field that has been licensed, that has been regulated, that has operated in these conditions, that make these conditions possible. The second thing is related to the $50 billion that Lynette spoke about. We have bipartisan support for significant investments in early childhood education in the next stimulus package. And for all of you out there serving young children, it is absolutely essential that you get to your congressperson, that you get to your senator, to your representative, to the White House. We are absolutely urging that a stimulus package be passed before the election. We know from survey data that we collect that without a stimulus package passed before the election, 50% of providers will be out of business by December. That means 50% of the marketplace will be gone by December. And that means 4.5 million spaces for young children across this country. And I think it is really important to be able to, we've got to save that. And that is our top priority. So if you have a minute, make those phone calls. And the final thing I want to reiterate is just, this is all of these conditions exist in a moment where, while we have 25 years of neuroscience that supports this field, we have even more decades of social science, we still haven't made the policy decisions to make conditions for early childhood educators what they need to be. And so all of this is happening in an environment where far too few early childhood educators have health insurance, where they have benefits, where they have retirement benefits, and where they have professional salaries. And that has to change. That has got to be our top priority. And so supporting the stimulus, but then also supporting robust spending and the actual funding from the public sector that we need to create a system that works for families, it works for children, and it works for the early childhood educators in the system is where we need to head, even beyond COVID. So thank you again for including NACCE and for all of you out in the field doing this work every day. We're here for you. We have your back, and we will continue to fight to make sure that this is an equitable, well-funded system.
Thank you, Rhian, and thank you to NACCE. Now I would like to ask Kimberly Belcher-Battle of NWRA to describe her organization and its support for the survey.
Thank you. So I will also reiterate our gratitude on behalf of the National Workforce Registry Alliance and the workforce registries themselves, just to providers for participating, and to Dr. Gilliam, who is such a champion for early childhood providers. And so, as she said, my name is Dr. Kimberly Belcher-Battle. I am the Executive Director for the National Workforce Registry Alliance. We are the unifying national voice for workforce registries across the country. We have 44 state members. We also have corporate members and government members. We have individuals. The work that the Alliance does is to sort of set quality and standards for workforce data collection. We provide the early childhood workforce registries with membership services, and we provide leadership. And we work to connect the data that they collect on the workforce to national organizations, to research, and to inform policy. So our work is to really maintain and grow the workforce registries across the country. But I'm happy to talk about our role, the Alliance's role and Workforce Registry's role in this study, which is really very similar to the work we do every day. We focus on putting the power of numbers behind the voices and stories that come from the providers in the field, and to be the vehicle for delivering support to the workforce. So in this case, Dr. Gilliam said, they needed tens of thousands of providers to participate to conduct the study. And we knew that workforce registries could directly access somewhere in the realm of 1 million providers with important information. And this was an example of how we disseminated something important to the field. So we mobilized the states. We had 28 states who were able to work together and collaborate to facilitate the invitation to participate in the study. I think we were able to reach somewhere in the realm of 700,000 members of workforce registries. And our objective really is, through this study, our work is, how do we leverage the opportunity in this moment, what we've learned, to strengthen what was once an invisible workforce, and continue to deliver the support and recognition and information they need to do what they do so well, which is to care for America's children. So, thank you.
Thank you so much. Now let's open up the conversation for questions. As I mentioned at the outset, in addition to our presenters, we're fortunate to have two of Walter's colleagues, Dr. Thomas Murray and Dr. Saad Omer, joining us to add to the conversation. Because we have a very large group today, I'm asking you to please type your questions into the chat box along with your name, and we'll read the question to our presenters. We have our first question now. Did you take into consideration the fact that schools were closed in the cities and states that were in the red while emergency childcare was open? Might it be different if both schools and childcare are open?
Well, that's an excellent question. And certainly many of the childcare programs that were open during the early parts of the pandemic were open specifically because they were providing essential care, childcare for essential workers. And what that might have done is it might have actually increased the likelihood that a transmission could have happened if it were likely to happen at all. And Dr. Saad Omer, the epidemiologist on the report, probably can answer that question even better than I can. But I do want to put in one thought, which is the fact that when you're talking about the fact that this was essential childcare for emergency workers in many cases, it heightens the point that these childcare providers who were providing this were taking a very big risk at a time when many people were very worried about COVID-19 and whether or not COVID-19 could be transmitted within childcare programs. And so, despite the impact that might have had on the findings, it certainly had a huge impact on the fact that we were asking our childcare providers to do something incredibly brave, and they did. Saad, can you add to that for us?
Yeah, so just to add to what Dr. Gilliam said, we did not directly take into account whether schools were open, etc. But what we looked, and there is uncertainty around the direct impact of schools in terms of the magnitude of transmission within communities. It's because studies like ours need to be replicated for schools and other educational institutions at a large level. So there is some partial evidence there. But what we did take into account the overall community experience. And there was indeed an association between how much transmission was going on within the community and provider's own risk, irrespective of whether the childcare facilities were open or not. So to directly answer your questions, no, we didn't take into account the impact of school opening specifically, but we did look at the overall community experience in terms of transmission.
Excellent. Thank you so much. The next question I'd like to pose to Dr. Murray. I am an infant toddler teacher, and our main concern is the amount of bodily fluids we are exposed to. How do we protect ourselves without wearing obtrusive PPE?
Thank you. That's an excellent question. And first, let me thank everyone for all the work they're doing and putting themselves at risk, being exposed to body fluids and tears and those kinds of things. So PPE has been a struggle for all of us throughout the pandemic. And the short answer is we do the best we can with what we have available. So I'm just going to show kind of the bread and butter that we tend to use, which is the surgical face mask. And this is relatively unobtrusive. You can't wear it for 3 days, but you can wear it for a few hours, fairly comfortable. It's light, and it does a pretty good job of offering protection from secretions. The other thing, though, if you're in a situation where there's babies crying and there's a lot of things going on, something like a face shield also offers. It's not a great look, but it works very well, and these can also be cleaned. Again, I realize you may consider this obtrusive, but having worn one of these for a full day, it can be done, and it's not terrible. With respect to the body coverings, any kind of paper or cloth gown can be worn, or apron, and can be washed at the end of the day. And if those kinds of things aren't available, then when you come home, it's really important to launder your clothes immediately and change into a fresh set of clothes. The good news about this virus is that it is easily killed with standard laundry detergents. So if you come home and you use your Tide or your Clear, that will effectively get rid of the virus off your clothes, and you'll have them ready for the next day.
Excellent. Thank you so much. I appreciate that response. We have another question here that I'd like to direct to Dr. Gilliam. Does the study tell us anything about which mitigation strategies are most effective?
Well, it doesn't tell us right now which ones were most effective, but that is something that we're going to be looking at next. We're going to be looking specifically at which ones of these strategies might have given us the best bang for the buck. At the beginning of the pandemic, I think the sad reality is that many of us didn't really know what kind of recommendations to make. Federal government didn't know what kind of recommendations to make. We were basing it off of the best information we had on how other viruses might travel. But again, this is a novel coronavirus, and novel meaning we don't know how it's going to behave. And so the experts, whether that means experts in the government or experts at professional organizations or experts in academia, like me and my colleagues, Dr. Omer and Dr. Murray, we didn't really know what to say. So as a result, I'm afraid that the recommendation was do everything. And then, of course, what that basically means is that if there were a problem, then it wouldn't be the experts' fault, because after all, they told you to do everything. And so what we need to do right now is really focus more on what specifically might have been the most likely to actually give you the best bang for the buck and the greatest degree of mitigational efforts. But one thing is for certain, and that's that childcare providers were doing an awful lot to keep children safe in childcare programs. Dr. Omer, can I pass it over to you to make a few comments on that, and Dr. Murray to wrap that up?
Yeah, no, exactly. This is the very next thing we are looking at in the data we collected to carefully examine what factors specifically work. As our knowledge has evolved, the understanding that ventilation, for example, works really well in helping decrease the risk of transmission, making sure that there is masking as much as possible, at least among adults. It's easier said than done when it comes to young children. And continuing to do hand hygiene and hand washing, etc., these are the major factors. But there was there's increasing emphasis on appropriate ventilation and de-densification. Unfortunately, that seems to help. But the precise estimates of what is the impact of each of these factors, this is exactly what we are working on together.
Thank you so much. I mean, so we're talking about PP and we're talking about these other processes. I wonder if we can turn now to Lynette and Renee. I wanted to ask about the stabilization funding. What is this funding really utilized for? Can you provide us with more of a breakdown?
Sure. So I'll start, and Renee, please jump in. So firstly, I just want to share that for stabilization funding, and frankly, where we were at the outset of the pandemic, there was a real need for access. So I think one thing we need to talk about when we're talking about PPE is making sure we have access and that providers are able to cover the expenses of all of the kinds of things that Dr. Murray was talking about, the masks and the protective gear and the equipment, sanitizing equipment and so forth. So stabilization funding is not only to support the urgent needs of the actual provision of care, but also the fact that there's a real gap between how much it is costing providers to actually provide care with the increase in staff, the smaller group sizes, the less children, plus the cleaning and sanitizing equipment and so forth, changes to facilities, changes to places and environments. There's a real gap between what's coming in for providers and how much it's costing providers. That's part of the stabilization. It's also supporting parents to be able to have access to quality care too, and safe care. It's training and technical assistance supports too. So Renee, do you want to jump in and add some other content around stabilization dollars and why it's so important?
Sure. Thanks, Lynette. I think we have to remember that this crisis hit our field and this industry on what was already a really fragile economic system. The supply and demand of childcare has never really met, and we've always underpaid and undervalued the true cost of care. And so this has exacerbated what is already a fragile economic circumstance. We saw in the first week of COVID back in March, we saw 70% of enrollment drop in most centers across the country. And again, childcare is funded on supply and demand. So it's funded based on whether a child is in attendance on a Monday. And so to have that dramatic drop in enrollment that was sustained over time, and it's still, we believe on average, enrollment is about 50% right now across the country. And so providers are upside down economically. They are bleeding more financing than they're getting in. And so the stabilization, we know from all of the things we know about this disease that it is going to be it is going to take a while to recover. And so the stabilization money is to hold constant and consistent the field while we slowly recover over time and while enrollment grows. So you think about all of the providers out there that while they have fewer children, they still have their utilities, they still have rent, they still have their mortgages to pay. They have all of the costs associated, as Lynette said, with the additional health measures and cleaning measures that they need to take. And so the economics just don't work. And the reason we know that 50% of providers have said they will permanently shut down by December is they can't afford to stay open because they're bleeding money, quite frankly. And so this $50 billion over time, our ask is that it then go out in for fixed costs, for utilities, for rent, to make sure that these programs can keep their lights on while they're taking these Herculean steps and increased health measures, and while enrollment is lower than what it typically is to be able to make ends meet.
So through this conversation, we've talked about what we're learning about this novel coronavirus and risk for transmission to providers, how to keep providers safe. We've talked about what's going to be required and now the cost of it. So I want to pose another question to Lynette, Renee, and Kimberly. How can childcare providers and parents unite to present this information to Congress and show an urgency to create a care economy for our children?
So, Renee, I'm going to jump in and provide a really quick response, and then ask for Rian and Kimberly to jump in as well. But my first response is that we need to ensure that we're activated as a provider community, as a parent community, and frankly, vote in support of childcare, making sure that your policymakers are really clear about the pain both providers are feeling and parents are feeling on behalf of caring for children. So raising up all of the things that Rian mentioned that are needed for already a fragile system, we want to make sure that what happens as we get on the other side of the pandemic is that we have even a better and a more re-envisioned childcare system. And we need to put pressure on our policymakers that this is something that we all care about, and that is really critical for our family success, for children's success, for community success, and for communities to grow and thrive. So with that, I'll turn over to Kimberly and then perhaps Rian.
Okay, sure. So I agree with what Dr. Fraga said. I think, we're coming up on an election and we talk about your vote count, but from our perspective, workforce registries exist in 44 states, primarily for the tracking and recognition of the workforce. So I would say, you count. And in order for us to make sure that you count, you need to be in that system. So we need to be able to capture providers and to pull those numbers together, whether it's for equity investments, whether it helps talk about a living wage, whether it's how we talk about what you need, but it's also how we get information to you. And in cases like this, it's how we raise up the needs of the workforce. So for us, I think, looking in your state for your workforce registry and making sure you're part of that is a big contributing factor.
The only thing I would add, I echo everything that Lynette and Kimberly said. The only thing I would add is you've already made a difference. Your voices have already made a difference through the surveys that we have done, through your contributing to your story to the study. Your story is being told. And if there's any silver lining in this mess, it is that the public has never paid this much attention to childcare. We've never covered had more media outlets cover the story of childcare. And it's never been more blatantly obvious how critical childcare is to the rest of the economy. The rest of the economy in this country only works if childcare works. And so I would say keep at it. It has made a difference. You can engage through Childcare Aware of America. You can engage through NACI, through social media. You can sign up for advocacy alerts. But know that it's already happening. And we would not even have a bipartisan commitment the way we do right now without your voices. It matters. And as Lynette said, you have to vote. You've got to vote and participate civically in order for us to make sure that we get these messages across.
Thank you so much. That's terrific. There's something that all of us can do immediately to make a difference. I want to turn back to some of the questions we're hearing from providers about how to be safe. So Dr. Murray and Dr. Omer, I want to pose this question to you. The study was done when many people in our communities were taking far more precautions than they are now. Does this change the likelihood of COVID-19 spreading in childcare? How do we interpret this?
So the first thing I'd like to recognize that I think we'd all agree there's a degree of risk mitigation fatigue out there. We've all been asked to do a lot of things for a long time that we're not used to doing. And so that continues to be quite a challenge. So what the study found was that when there's increased COVID in the community, like there are now in many different places, there is certainly an increased risk for everyone in that community to get COVID, including childcare workers. But that working in the childcare center itself doesn't necessarily increase that risk. So the goal then is to really try to keep COVID from the community from being brought into the childcare center. So that can be done in a few ways that childcare providers are doing a great job of: symptom checking of children when they come in to make sure sick children are not being brought into the childcare center, educating parents and reinforcing that this is not the year to give your kids some Motrin and try to get through the day without a fever, as so many of us have been guilty of in the past, including myself. This is not the year to do that. And the same goes for staff. If staff aren't feeling well, like Walter talked about before, we need to support you so that you can stay home and not have to worry about where your paycheck is coming from, so that you don't put people at risk. So those are some of the things that are really important to keep the spread of the community from entering into the child care center. And I'll turn it over to Saad for some additional comments.
Yeah, so without repeating all of what Dr. Murray said, I'll add that unfortunately, as the overall rates increase, even if there is no difference, it's likely that there is unlikely to be a difference between open versus closed childcare in terms of transmission. The absolute risk is likely to go up. We are looking at a third wave in the US. It is highly, highly unfortunate. But unfortunately, we are looking at the possibility of the absolute likelihood of people getting infected, irrespective of where they work, going up.
Yeah, and I'll just add one more thing to that. That means that the risk mitigation strategies we all employ when we're outside of the workplace are also really important. When we're going out, when we're choosing to engage in social activities, much of the spread lately has been tied to households, gatherings, and things like that. So it's really hard to not let your guard down when we've been asked to do so much for so long. But as Dr. Omar mentioned, it's more important than ever.
And to build on what Dr. Murray just said there, here's some additional analyses that actually aren't in the paper. So we ran a few additional analyses, and when we asked providers about the types of things that they were doing in their personal life, at home, not associated with what they were doing in childcare. And we were asking questions about, did you wear a mask when you went in public? Did you socially distance? Did you find yourself canceling social events that might put you at greater risk? One of the things that we found is that the childcare providers who were going to work on a regular basis reported engaging in more safety precautions in their home life than the childcare providers who were staying at home. And what that suggests to me is this. It suggests to me that these amazing childcare providers that we have were so worried about transmitting to the children in their care that they were taking care of themselves better in order to not do that. We asked childcare providers what kind of worries they had, and 77% said that they were worried that they could get sick if they go to childcare. 74% said that they were worried that they could bring COVID home to their own family by going to childcare, but the largest percent, 79%, said that they were mostly afraid that they would bring childcare into the childcare program and infect the children. And one of the things that I think is just a really touching element of all of these analyses is this. These childcare providers weren't just working to keep babies safe when they were working in the childcare program. They were thinking about these babies even when they were going to the grocery store.
Wow. Thank you. So, we have this juxtaposition, the fatigue around risk mitigation strategies, and then thinking of these essential workers that are actually carrying this additional burden of trying to mitigate risk. I want to turn for a moment to start thinking about and exploring some additional mitigation strategies. We've had a few questions that have come up about ventilators, air purifiers, heating, ventilation, and air conditioning systems. What should providers do, and what do we know about what's effective? can we stay here with Dr. Murray's and Dr. Omer in responding to these questions?
Yeah, I'd be happy to go first. We do know that improved ventilation is helpful. We do know that, especially natural ventilation, etc., increasing airflow is helpful. The specific, so far as the specific impact of some of the, of the purifiers and HEPA filters and that kind of stuff, that is not, that is emerging evidence. But so far, reasonable environmental engineers, etc., have provided guidance against the, not against, for the use, just to be clear, for the use of these kinds of things, while recognizing that they have to be a part of a comprehensive approach. So they're unlikely to be effective on in their own, even if when we develop evidence and the evidence suggests that they work well. So use them. It's okay to use some of these things like purifiers, and especially as the weather warms up. Before that, I think natural ventilation, de-densification in the sense that where possible, in terms of open spaces and so on and so forth, and having activities in situations where outside or in relatively more open spaces is helpful.
So helpful.
And the one thing I'll add to that is with respect to some of the portable HEPA filtration systems, you can look at how much air is pulled through that system per hour. And if you have a sense of the size of the room that you're in, you can calculate how much a bang for your buck that you're getting and what size purifier or how many you may need to provide additional protection. If you take a small purifier and put it in a big room, it's not going to help as much. So you want to make sure you get something that's the appropriate size for the area that you're trying to provide some enhanced protection.
Excellent. Thank you. Dr. Murray, I want to pose another question to you. We're getting some questions about what to do if a COVID-19 case presents itself in childcare program, or even what health issues should be considered before a program excludes a child from childcare. And where do we find the most accurate and up-to-date information about what to do?
So I'll take the second one first, if I may, about how to handle the sick child who's asked to not come to school. And many different states have specific guidelines and algorithms around the criteria for return to school. I'll give you my own take on them. So this is just my own opinion. In general, we know that children can have mild symptoms related to COVID-19. So in areas where there's high prevalence, I would encourage providers to encourage families to get their children tested for COVID-19 when there's any question about whether that's one of the symptoms: fever, cough, congestion. Kids can have vomiting and diarrhea as well. So hopefully, people are located in areas where there is access to testing. If they've been exposed to someone who's known to have COVID-19, so if it's a parent, for example, then that child unfortunately needs to be removed from the daycare for 14 days, regardless of whether or not they have symptoms, because that's how long it takes the virus to develop infection in certain populations. If, on the other hand, it's a child who's not been exposed and has a cough, for example, and has asthma, and every time the child runs, they cough, and that's been that way for 3 years, then a healthcare provider can provide an alternative diagnosis in most cases. But I want to emphasize that given the increasing rates around the country, you really want to be sure that alternative diagnosis is pretty rock solid. And so I tend to err on the side of testing whenever possible if there's any question.
Okay.
Yeah, I think you covered it very appropriately in terms of how to act, etc., how to handle children who are exposed to a known case as well. And it is there is some variation, etc., but generally speaking, it is appropriate to quarantine kids who are other kids in the in the facility that have met the definition of exposure, so to a known case of COVID. So your idea is, unfortunately, outbreaks expand fairly quickly, and something that may sound aggressive right now, in retrospect, often sounds prudent. And so therefore, if other children are exposed to a known case, it is appropriate and prudent for them to follow the quarantine guidelines, et cetera, 14-day quarantine and that kind of stuff, so that you stop that outbreak from spreading other children and other staff that are exposed to the known case.
Thank you. And then I just want to follow up around the best source of information. Does anyone want to just share where?
I can start, etc. Look, I'll be candid. In this outbreak, there has been an erosion in trust in our federal agencies. But at the core of it, especially for several of the non-controversial guidelines, CDC does remain a good source of information. But if you want to complement the source, AAP, the American Academy of Pediatrics, has been putting out very good guidelines when it comes to younger children and individuals, etc. So these are the two solid sources. After that, there are state-specific nuances, and it depends from state to state. But if you want to have two sources where you want to go to when you start looking for information and guidelines, it's the CDC and the AAP, the American Academy of Pediatrics.
Thank you so much. I want to turn to a question now posed to Lynette and Kimberly and Rianne. Can you all share how you all are sharing the study and the message that comes from this study with childcare audiences and also with other stakeholders? What strategies are you all using to disseminate this information?
So I'll jump in because I've firstly have so enjoyed and appreciated this conversation about information for parents and for providers. So thank you. I did want to raise up that at childcareaware.org, we do have information like Dr. Ramirez shared from CDC and AAP that we've utilized as a basis for information, for materials and resources that are meant for providers and for families to make choices and to keep informed and so forth. So I do recommend you take a look at that. I also want to raise up that child care resource and referral agencies and communities, in partnership oftentimes with public health, are also developing and also creating collaborations and partnerships to ensure that parents and providers have the information they need to make good choices. So as we're trying to identify those resources for families and for providers, I would like to raise those up as well as really important access points.
I'll just add, thank you, Lynette, and I will just add too that we will be working now, the study is released, to get this information out to our constituents and to the field. And I think, this re-emphasizes how important the connections are between research, policy, and practice, because research is one of the key ways we can inform decision-making from a policy perspective. And so I see this study, and I know there's additional findings that are going to be looked at, having really long legs. And it's, to have objective work, data-driven objective work that is a research-based study, to then say, to be able to make the case that the stimulus is needed and stabilization funding, and to be able to work with states. As I know, state administrators, childcare administrators across the country are working hand in hand with governors' offices to get as much information as quickly as possible out, and to make decisions about what's in the best interest of children, what's in the best interest of early childhood educators, and to have this type of data available to be able to make those decisions and have them be data driven rather than kind of guessing in the dark is really important. And so in that regard, I think this study will be absolutely essential. And for all of you, so many of you on the call tonight who are in those roles, take this and use it, and use it as you think about the decisions you're making on behalf of the field.
Yeah, I think, you know, I mean, we're also just, as the study has been released, and we're trying to pull information together on our own websites. So on ours, it would be registryalliance.org. But I think for providers, probably the best source of information for you on a continuum is to look into the Workforce Registry in your state. And I kind of stay in that generic term, but they have a name in every state. So in New York, it's the Aspire Registry. In Pennsylvania, it's the Pennsylvania Key. You know, Nevada's is the Nevada Registry. But if you look in your state, those offices are providing learning management systems. So the online training is provided through their platforms. In like 26 states, they have the training calendars. And I think they will continue to work hard to make sure that you have relevant, important information that you need to do the work you do safely.
Thank you so much. I'm going to pose the next question. We know the flu season is underway. What can providers do to address the flu while addressing COVID-19? Is there anything we should be doing differently knowing flu season is coming? Dr. Murray, would you like to weigh in?
Sure. So the first bit of good news that we hope holds is that in the Southern Hemisphere, where typically flu precedes us, there's been a reduced amount of flu this year, hopefully because the masking and some of the social distancing we've done from COVID has affected the flu. However, as Dr. Omar said, we are headed into a third wave, which means our hospitals are going to fill up with lots of COVID patients. And we really, really don't want to compound that with lots of patients with influenza. So the best thing that you can do is get a flu vaccine this year to really help prevent the spread of influenza. And while COVID, fortunately for the vast majority of young children, is a very mild disease, we also know that there's a subset of children that get very, very sick from the flu. And the symptoms and signs, it's very hard to tell the difference as there's a lot of overlap. So just encourage everyone out there to get their flu vaccines and to stay safe and wash your hands.
Thank you so very much. I want to circle back to Dr. Gilliam and ask if there's a little more research coming out on this topic. Do you have any more that we should be looking out for or that's underway with analysis right now?
Wow, that's a great question. We have a lot that we need to find out for this field in order to be able to give you the answers to the questions that I know that you have. And so part of it has to do with looking again at these types of different enhanced safety things that childcare providers were doing and trying to better understand which ones of those might have been the most effective. And another thing that we would love to look at is understanding better the racial and other types of disparities in terms of who was most hard hit by COVID-19, and how do we understand resource allocation within that and making sure that those who are hit the hardest are also those who benefit the most. And also at some point, turning our attention to understanding more about the mental health needs of those that are out there. We collected data about amount of job stress that these childcare providers were under, and we collected information about the amount of depression that these childcare providers are under. And one thing that kind of happened by complete happenstance, by accident, is that at the beginning of the study, all of us were dealing with one virus, and that virus was COVID-19. But halfway through the data collection, right at the time that we were starting to collect more information through additional reminders, Mr. George Floyd was murdered. and the effect that that had in terms of bringing back to a heightened awareness the other virus that has been on our shore far longer, for 400 years, the virus of racism and the virus of biases, trying to understand how that might have impacted the way in which people responded to the mental health questions. Because literally right in the middle of data collection, it wasn't just one virus, it was a resurgence also of a second virus. And so we would like to look more at all of those different kinds of things, but I'd also like to make a plea out there, which is that the information shouldn't just come from us to you, to the field. I mean, I hadn't thought of this before, but we do have an email address for this study. It's covid19.childcare@yale.edu. Childcare is one word, covid19.childcare@yale.edu. Tell us what you would like us to be studying next. What would you like us to study? What kind of burning question do you have that we could answer for you? Put us to work. Now let's make this perhaps the biggest experiment in community-based participatory research ever. You've got researchers here who are dedicating their time to helping you as child care providers do the very best job that you can, not only for your children and families, but also to keep you safe. What are the questions that you would like us focusing on next? Email it to covid19.childcare@yale.edu, and I promise you we'll take a look at every one of them.
Thank you so much for the invitation, Walter. That's excellent. I hope everyone's written that down, and I'm sure there are already ideas percolating. So get those fingers moving on the keyboard. Let's end with this. The first part of this question: when a vaccine becomes available, will childcare workers be a priority in receiving it?
So yeah, so the recommendations are being finalized. So, but actually, I was fortunate to be a part of the National Academies of Sciences committee that was charged by the CDC and the NIH to come up with not just a federal allocation framework, but that applies, that could be relevant to states and territories, etc. So within that, we actually started with the ethical aspects, then scientific aspects, epidemiological aspects, and we said we came up with an allocation framework prior to a vaccine itself becoming available. Because there will be vaccine-specific characteristics, those recommendations will be made by a CDC advisory committee. So there will be two tiers of it. I am actually fortunately a part of a similar process with the World Health Organization. And so we have thought through some of these issues. And here's the bottom line. First of all, children are extremely important. And one aspect is irreversibility of outcomes. So their outcomes, death is the most irreversible outcome. So there are certain groups prioritized because of that. And other healthcare situations where you need to preserve a healthcare system that is critical to keep people alive, including first responders, etc. So that's part of it. After that, there are other aspects of long-term effects, which the evidence is emerging. But a third irreversible, a third set of outcomes that are somewhat irreversible is child development, which is age-dependent. If you have missed some of the milestones, etc., it's hard to recover that, and especially you introduce lifelong disparities. And so based on that, and based on that, the data from the trials will come down the line in children, because the first trials are being done, the vaccine trials are being done in adult populations with a specific focus on the elderly. Children are not in the first two phases, because for them, the data will become available a little bit later. In the second phase, in the National Academies recommendations, which is likely to be adapted, are teachers and staff in schools, as well as those who are working in childcare facilities. It's right up there, very early. The first stage is directly focusing on morbidity and mortality and first responders who are right at the front line. But soon after that are folks like you and at the school level, etc. University professors are not included in that, because childhood, the younger you are, the more irreversible these kinds of outcomes are. And so that's the emphasis. So the important part is as the vaccine becomes available, as a review after proper safety and efficacy review, and frankly, just to be straightforward, there had been a lot of concerns around interference and going outside the normal process for an approval for a vaccine. And some of us have advocated for sticking to the mainstream process. For this, you can still be fast, but you can still take all the necessary steps and the required steps to ensure efficacy and safety of a vaccine, even if you're doing things on a pandemic speed, because there is an ongoing pandemic, and there's a real scientific and public health reason for having a good, smooth process for this. So after that, and after this, recent signs have been good. FDA has come out with its guidance to evaluate these vaccines using expedited but mainstream safety and efficacy criteria. Pharmaceutical companies have said that they're not going to seek it before they have reasonable data, seek approval, authorization. Even if it's emergency use authorization, they're not going to seek those kinds of things. And CDC has come out that they will sort of work through their independent advisory committee process. So just to sort of address that somewhat elephant in the room, I think there is a reasonable expectation that if those things are followed, if Dr. Fauci says that it's safe, for example, meaning he's a stand-in for mainstream scientists, if AAP says that it's safe, or sort of other independent advisory committees say that it's safe, then it is on us to get vaccinated in high numbers, because it is indeed a privilege to be prioritized, because the society recognizes the important role teachers and childcare providers play. But we have to meet that goal with higher vaccination rates.
Thank you so much. Well, this has been an incredible conversation. I think we've all learned a tremendous amount in a short period of time. I would like to invite our incredible group of speakers this evening to each give us one very brief closing comment about what we should be doing next. And I'll start with Dr. Gilliam.
Well, if you're watching this video right now, it's probably because you care deeply about others, about children and families. And so my request to you is for you to take time to care about you too. We need you in the long run. You deserve to be cared about, and we need you here for the children and the families. And the best way for that to happen is for you to make sure that you are well as well.
Thank you. Rhiannon Evans-Alvin.
Thank you so much. We have more than 2 decades of neuroscience touting the value of early childhood education. We have economic science touting the value of early childhood education. We now have this research study that says that these professional women are in professional settings are doing making heroic efforts to professionally take care of young children. And yet we have mostly women earning on average $11 an hour. 46% of them are eligible for public assistance in their own households. Many of them have no health insurance. And if this is not a clarion call that we have got to connect the science with the policy, I don't know what is. And so the biggest step we have to take moving forward as we get through this crisis is to invest in early childhood educators as a professional field of practice, earning professional salaries, much like all of us and the researchers who have done this extraordinary study.
Excellent. Dr. Belcher-Badel.
Thank you. I yes to all of what you said, and it might not be the most important thing, but I will reiterate that in order for us to report the data that reflects the workforce, to put big numbers behind your stories, it's really important for providers to be in the workforce registries in their state. That helps us represent you. It also helps us get your needs met. So like help us help you by getting in there and making sure that we know what you need.
Thank you. Dr. Omar.
So yeah, very briefly, a couple of things. First of all, just to remember that the findings we had of not additional risk are dependent on, they're not due to any magical effects of being in a child care facilities. It's because of all the hard work and all the efforts that were done. So stay at it. It's hard. Keep up to date. And the questions were reflective of an increasing understanding of what the recommendations are. So please, thanks for doing this. You're the most essential of the essential workers because, without exaggerations, you have the future of this country. You deal with that. And as research, and at least specifically in the past couple of decades, it has indicated that this kind of period has implications well beyond the next, the first 2, 3, 4 years after they come out of childcare. That has lifelong implications. So if that's not essential, I don't know what is. The last thing I would say is, look, we learned a lot from this data. It had to be large for us to draw conclusions. So close to 60,000 people were included in our final number that we included. Continue to do that. Continue to sort of share your experiences. If there is a next round, please continue to participate in this kind of things. But because research is nothing without data. And so as we continue to ask questions, we will rely on you. No pressure.
You. Dr. Murray.
Hi, thank you. I just want to add a couple things to that. The first is one thing I didn't get to mention that I think it's important for people to know is an area where we've seen increased exposure and risk is around eating and drinking. And because those are things you can't do with a mask. So just urge everyone to pay a little extra attention to areas when you're eating and drinking. The second thing is just to kind of reiterate with what both Walter and Saad said is that we are really committed to learning what's happening in your environment. And I know this is my first foray into studying childcare and infection prevention with Walter, but we're in it for the long run. COVID will eventually go away, but there will be other respiratory viruses, influenza, other opportunities. And I would like to affirm a commitment to work with this community to understand and try to prevent infection transmission in childcare, not just for COVID, but well beyond that.
Excellent. And Dr. Fraga.
Such gratitude. Such gratitude is my closing comment. For all of you on the phone, providers, for the brilliance of this panel and the commitment, gratitude for our collective commitment for what's next. For the new commitments, Dr. Murray, that are being made. Thank you, thank you, thank you. And for each of you to change our childcare system for the better on behalf of children and families. Thank you. Such gratitude.
Well, I would like to thank our presenters and to all of you for the excellent questions. What an interesting Friday evening we've spent. We truly appreciate this valuable study. The representatives from Yale, Childcare Aware of America, NACI, the National Workforce Registry Alliance, for taking the time to share these results, explain these results and their insights to us. I also want to thank you all for attending and spending your Friday evening and for participating in the study. I hope you agree with me that this was time well spent and we are just at the beginning. I want to remind you to visit childcareawareofamerica.org/Yale to link to the full report and explore all the resources and recommendations you'll find there. Thank you and have an excellent night and a wonderful weekend.
Good evening.